y'all. I'm starting out early and hoping to send a shout out to Miss Kim, not Kimberly, because today we'll talk about health. And she brought up when in response to my glass situation, if they're prescription, yes, all my glasses are prescription. I'm super nearsighted. I think I've had glasses since at least fourth grade. You'll see I'm only rotating between, I think, 6 pair right now because I packed at least 20 pair. Yes, welcome to buying from Zenny. I've packed 20 pair and a year's supply worth of contacts. And I do intend on actually wearing my contacts while traveling around the continent because going along with the health concept, we got to talk about COVID, vaccinations, inoculations, everything that I'm supposed to have or everyone's supposed to have before you head over to the continent. And what does that look like? So for me personally, I booked with Delta because they were blocking seats. American doesn't really go to the continent of Africa like that. When they do, they only go to Morocco right now or in that area. And it's through travel partners because I had credits on American that I won't be getting to use. And instead, I'll just make do. I've already bought the ticket. I'm already locked and set. It dropped again today in price, but it didn't drop to the price I needed to for that 2 p.m. flight, which is what I prefer. I'll be leaving at 9:45 a.m. and just have to sit in the JFK airport a little longer than expected. I hope to reach out to a friend in Brooklyn and hang out with her for a little bit. But part of me also doesn't want to deal with going back through TSA. So I may just sit in the airport and make do. As for my vaccines, I'm up to date for everything. And I have it all on the state registry. And I did double check. I do plan on traveling with a hard copy. I got this from as a tip for an expat, husband and wife combo that actually moved to Ghana. Her father, though, is from Ghana, or she has Ghanaian descent heritage there. But anyway, I want to have an electronic copy because I use my chart and to talk through my doctors and the nurses staff since 2003. I mean, that's one of the good things about Wisconsin. Epic is right here. So they're the company that did the software for my chart in this area. But I know down south, especially in the Carolinas, they don't use my chart. They use another version. At any rate, I'm happy to take my hard copy document of my medical records that matter, that is of consequence, because I have real allergens. And I'm also happy to take an electronic version, for those who may be eager or able to access it. But those hard copies, I expect, if I heard from another, I'm willing to trust that she was really on it and she's there with her husband and 2 sons. So kids will always make you be super responsible or extra prepared, even if you don't really have it preparedness for yourself. And with inoculations, I have my appointment originally was set back in February when I didn't know when I was leaving. But they're eager to do it. There's like an international clinic here that's a part of my hospital and clinic. So my primary care physician will not do the inoculations. No. I did learn with the malaria and typhoid. Right now, the company closed that makes, I think, the malaria pills. Or is it the typhoid pills? Sorry if I'm confusing the two and using it interchangeably. I'm aware they're not interchangeable. But one is a shot, one was the pills. Well, she mentioned because the company closed for COVID that I'll have to get a shot for both. And I'm actually happy about that because I have heard from It's Idioma. If you haven't checked her out, she was in Lagos, Nigeria for a minute on, I think in Lekki phase 1. Now she's back stateside. At any rate, I know it could be harsh. And I just had food poisoning for the first time ever in life and it lasted an entire week. So I wouldn't wish that on anybody. And if typhoid or malaria comes close to any of that, I'm real good. So I'm happy to get my shot scheduled since I now have a firm date of when I'm leaving. And as for my personal health, I got my blood work back last night. It started trickling in. My A1C is down 0.2 of a point. My glucose, everything that should be down is down, and everything that's in the proper ranges is there. So my only concern is my LDL, the bad cholesterol, was super low. I mean, it was in the 30s. I was like, yo, is that dangerous? So I Googled, and I think I made things worse because I can get some kind of stroke that starts with an M. And like my brother said, Hell, I didn't know there were different kinds of stroke. I just thought a stroke was a stroke. And I was like, good point. Oh, I'm not trying to die. But my doctor's appointment is Tuesday at 12 noon. So I will be questioning him to death about these things. Like, hey, I'm fine. My HDL is good. I understand my LDL should always be low. But is it okay? Is this low? Because I don't need to die. Not that fast. I at least want to enjoy myself before I die. So for someone else that came in the comment section, if you're still hanging on, no, I've never been to the continent. I have no connection to the continent. I have no former friends, family, anything like that. This will be a brand new, first time ever trip. And I don't think it's brave, but maybe because I'm being ignorant or, less, I don't know, smart about it. We're not allowed to use stupid in my family, so it's hard for me to like conceptually say, I don't think it's stupid, but I don't think it's brave either. Some others may disagree, and I'm okay with that. I just think I'm ready, and because I'm ready, this is what I'm doing. Thank y'all.